Welcome to episode 4 of the third season of the Simply Verified Beef podcast. The title of this episode is Trusted Herd Health, and we'll be talking about how having a tried and true herd health protocol can take you through both what you're planning for and some things that you might not be throughout the year. Our guests for this episode are Dr. Pat Burrage, a veterinarian from Southern Alberta, Mackenzie Argent, a producer certified with Verified Beef Production Plus, and Ricki Fleming, the VBP Plus Operations Manager. Today, we'll be discussing how developing a herd health protocol with your veterinarian is mutually beneficial for both the producer and veterinarian alike. So to start us off, I wanted to ask everybody around the table to tell us a little bit about yourself, where you come from, and what your current role is. So maybe we'll start with Pat.
I am a veterinarian of geriatric distinction. I've been practicing veterinary medicine in Alberta for over 35 years. All of that has been in mixed animal practice. And when I say that, I had owned two different practices, one in Southern Alberta and one in Central Alberta. Currently semi-retired, doing a small amount of locum work for the local clinic, and have a few beef cows in Central Alberta myself, and so very involved with the beef industry throughout my entire career, and happy to be there.
Thanks, Pat. It's great to have you on for your experience as both a vet and with cattle yourself. Let's jump to Mackenzie next.
Hello, my name is Mackenzie Argent. I am a third generation cattle rancher just west of Cremona, Alberta, which is about an hour and a half northwest of Calgary. And I also am an account manager for Ad Farm Canada, which is a marketing agency based in Calgary. So I love all aspects of agriculture. I'm happy to be here and excited to chat today.
Thanks, Mackenzie. And Ricki.
Ricki Fleming, and I am a seastock beef producer myself down in Southern Alberta at Granham, as well as I'm the operation manager for Verified Beef Production Plus, and oversee some of the renewals and auditing activity for Verified Beef.
Thanks, Ricki. So the next question that I wanted to jump into is a question for everybody, and that is, what does herd health mean on a beef cattle operation?
From a verified beef perspective, herd health is an important aspect of your beef cattle operation, ensuring that you are managing your cattle to the best you can ability. You're working with your veterinarian to ensure that you're using the right products for the right treatments at the right times. And with a whole herd health program, you're doing a lot of preventative maintenance and treatments and vaccinations to make sure that the animals are staying healthy and not having to do any mass treating. You're just, keeping those animals healthy ahead of time, whether it's a mineral program, whether it's a vaccination program, and limiting the use of antibiotics on livestock.
So I would echo a little bit of what Ricki said. I think it's really important to have a protocol when you're thinking about livestock animals and what to do in situations, so you're not in a situation where you're mass treating for things that you're not 1,000% sure about. For me, as a beef producer, at the end of the day, anytime that your animals are sick or down, that's pounds loss and that's profit loss. So I think an investment in a good herd health protocol is one of the most direct return on investments you can make for your operation. Not to mention just overall animal welfare, obviously, is important to us as producers. So I also really enjoy having the protocol and the data readily available to me now. We're really fortunate to have technologies to help us to be able to, look back at a certain cow and see if her, calfhood has been sick year over year. Maybe that's something with the cow we need to look at and look at our genetics. And I really appreciate having the data to be able to make those sound decisions and also understand what type of disease challenge you might be facing. We've had situations in the past where we've had a little run of coccidiosis that, when you're in the trenches, you might not recognize that actually could be a correlation to the environment that they're in, or certain animals, or who has immunity and who doesn't. So I really appreciate the protocols for that.
Yes, certainly from a veterinary perspective, it's our intention is to minimize the health risk to all classes of animals that are on the beef cattle operation. And so obviously we have young and we have mature cows, and so there's a variation, but reducing health risks certainly provides opportunity to maximize your productivity. And when I say that, all operations are going to have a different vision of what maximizing productivity means. There's goals to the operation on where we want to be and how we want to do this, but our job is just to minimize health risk. And in providing protocols, because we're veterinarians and generally up to speed on new diseases, new drugs, new vaccines, we can keep the producer certainly current with what's available and what's working best. We have a working knowledge because generally we're working with a number of producers, and so we have a very good idea what's going on, certainly in our local geographic area, as well as what's sort of going on in Canada wide. It helps us as veterinarians not having to deal with emergent situations. It's more beneficial from the producer if we prevent the disease rather than treat it. And so overall, herd health is minimizing risk, making an investment in vaccination protocols, and putting the producer in a better position to succeed.
Great. Thanks, Pat. Ricki, I want to jump to you next for the next question and to talk about what is a herd health protocol as defined under the VBP Plus program.
So from VBP's perspective, there isn't a specific definition of what a herd health protocol is, but it can mean a few different things. It can start out as a plan as to what is your vaccination from your on a cow-calf side of it. What is your cow vaccination plan? What is your calf vaccination plan? Is there procedures that you're doing at birth, at branding, at processing, at weaning? Same with on your breeding side. It's kind of having that plan in place, knowing what you're going to do before you do it so that you have the right products that you need for those procedure days or events. And, you're saving that last minute rush to the vet clinic or to pick up the products that you need. The other part too is it shows that the producer or the operation has a valid vet client patient relationship, or a VCPR, which is important to know that that relationship is there if there is any extra label drug use or off-label use, that they're using it under the guidance of their veterinarian. The plan also can consist of, to that extent, what, if there is disease outbreak or illness that shows up, what is your plan for treating those animals? Option A, option B, option C. And also some plans also include, some help or assistance on, what decisions to make when the endpoints come for those animals as well. The one aspect that we maybe don't think of an immediate response, but part of that protocol also includes, who to contact in an emergency. What is the after hours number? And have whether it's a vet clinic, a specific vet, or if they have a backup clinic. So if you do have an emergency or after hours, who is it that you call? And on that emergency contact list as well it could have your nutritionist involved in there, or a bunch of different contacts. Really, it's just the emergency access to that information when you need it quickly.
Thanks, Ricki. We're going to jump to Mackenzie next to kind of flesh out that definition a little more. And Mackenzie, I'm hoping to get you to describe what your herd health protocol covers on your operation. So Ricki's talked about kind of the general structure, but can you give us an idea of what your herd health protocol looks like?
Yeah, absolutely. So we utilize a kind of data management system called CattleMax, and that's what we use to track all of our treatments, which animals are on withdrawal, which aren't, etc. I find it very helpful. In regards to the actual protocol, we sit down with our vet once a year. Either myself or my mom or dad or whoever has time that day goes and sits down with our vet, and we spend, I would say, about an hour going through kind of every common scenario that we would run into on the farm. So, for example, this year I sat down with our vet and we talked about what our vaccine protocol would be for both our cows and heifers at different times a year. We talked about what to do in the case of a scouring calf, a pneumonia calf, a mastitis cow. We added a few, like Pat was saying earlier, talking about new drugs that are available. We added those to our protocol to try out if needed as little tools in our tool belt. So really that's what the protocol is. And I have it set up almost like a manual. So anybody can pick it up. We look at option 1, option 2, option 3 for this particular illness or vaccination processing kind of procedure. And that's our Bible that we live with. So I sit down with the vet. We talk about what should be first defense, what's, better for our operation. Maybe, I mean, there's lots of times where first defense looks differently for every operation. So we talk about that with our vet and just kind of go through the whole thing. It's a great opportunity, I feel, to ask questions if you're running into a different disease challenge. I find it really interesting just to learn the new research that's come out, even on older medications, on what their effectiveness is on different, illnesses, technologies, vaccines. Your timelines sometimes change depending on new research or new challenges. So I really appreciate that. But that's what our kind of herd health protocol is in a nutshell. And then throughout the year, we're able to consult that protocol with our vet or the vet techs, pick up whatever we need and reference it for the following year if we need to make any changes.
Awesome. And Pat, this will kind of round out the past couple of questions, but from your perspective, what is the purpose of having a herd health protocol?
So as a veterinarian, we're a service-oriented business, and so we need to keep our clients successful, and minimizing health risk is a major way of doing that. Certainly, in my years in the veterinary profession, it's building relationships with clients, and through those years, you see the progress and you see the benefits of your involvement in those types of programs. Certainly, the cattle industry continues to turn with or without veterinarians in it. I always say veterinarians are like a cog in the wheel. The wheel will still turn if we're not there, but it turns a lot smoother if we are involved. And so it's extremely enjoyable to sort of start out with a new producer or somebody who's entering into a herd health program and watch the changes that occur in the herd over the few years in the beginning of starting that program, and see the benefits that occur, and certainly getting the feedback from the clients. Obviously, it's our business to keep them in business. If we're not doing things that help them, and certainly help them stay in business, we don't have any more clients. So it's a relationship that you develop over time, but it's very rewarding, because it benefits both sides of the coin, and certainly it benefits the industry overall.
That's going to flow nicely into the next question that I want to direct to Pat and Mackenzie. And that is what the process of developing a herd health protocol with your vet looks like. So, Mackenzie, I know you've chatted a little bit about sitting down with your vet once a year, and Pat about that ongoing relationship. But what does that conversation look like? Where does it start? How do producers and vets interact in that kind of conversation?
So like I mentioned, once a year, we sit down with our vets and we talk about all the different challenges we've been facing that year, what to do in those scenarios, what our first line of defense versus second line of defense should be, for really anything you want to chat about. Our vet's really good that way. One thing I didn't mention earlier that I think is really important to call out is I know that when it first came out to sit down with your vet and talk about these herd health protocols, a lot of people have mixed opinions about it, which I can understand, but it honestly, I find so helpful. It's some undivided attention time with your vet where you're not trying to, perform a C-section at the same time and ask about your vaccination protocol for the year. It's some great one-on-one book time with your vet where you can ask any questions you have, talk about new drugs, new opportunities, that I just appreciate so much. So for me, that process and the process of building that relationship is really having that opportunity to sit down with your vet once a year, foster that relationship, foster that trust between yourself and your vet to go through, what you're comfortable administering versus when you would call the clinic, things like that.
Yes, and so most producers are aware that the veterinary profession is certainly under some stress, uh, not having the human resources or the veterinarians and or the veterinary technologists that we'd like. And so it's really difficult for veterinarians to contact producers or new producers. And so I would encourage somebody new or somebody's interested in contacting their veterinarian rather than sort of waiting for a contact from the veterinarian, or trying to make that contact during an emergency situation. Those never seem to work out well, and the conversations are difficult at that time. So I will very much agree with Mackenzie. A time of year when things are sort of under control and you have lots of time to have an open discussion, that's the way to do it. Again, I like Mackenzie's description of fostering relationships, because to me, it's a big deal. I deal with veterinary students and young veterinarians and encourage them that this is a lifelong commitment on both sides. And so, I tell the young ones, you want to spend 30 years with this producer because that's what's the rewarding part of our profession is. So it is really the responsibility of the producer to contact the veterinarian and get the ball rolling as far as the conversation goes. There are challenges, and that's why it's better to engage in those conversations early rather than when problems are arising and it's hard to find somebody to help you out. So both Ricki and Mackenzie are well aware of the situations that occur when things are not going well, and the difficulty in accessing professionals to deal with those situations. So getting out ahead of it is by far the best way. It's an investment rather than an expense. I know veterinarians aren't free and it costs money, but it's certainly in the long run will certainly pay for itself.
Thanks, Pat. I think Pat and Mackenzie have done a really good job kind of setting this question up. The question is, how can a veterinarian continue to be a resource after you've created a protocol? And I think you've really touched on, the relationship that develops over time and how that kind of helps keep you connected. So maybe I'll jump to Ricki and see if you have anything to add on that point of how a veterinarian can continue to be a resource once you've created that protocol.
Both Pat and Mackenzie touched on some really important aspects of it, and it truly is a relationship. And producers are trusting their veterinarian to help them make the right decisions, and the veterinarian is, they have that relationship with the client or the operation that they are comfortable doing the procedure or treatment that they've been set out to do, and with that whole protocol aspect, it helps build the trust and relationship, and having that longevity of a relationship with the vet clinic or your vet. It does help with the relationship down the road. So the longer that you have that relationship, the more trust you build, and the more things that everybody is comfortable being done or let being done. A vet with a new client is a little bit more hand holding until they kind of see how things transpire. And as things evolve over time, it's you build that trust and relationship. And I think that's huge of what it all boils down to. And it's nice to have those vets in their resource pocket. It's a tool in the toolbox to ensure that you're raising the best and the safest beef product you can.
I had one more comment, I guess, more on things that I think our large animal vets especially are doing such an amazing job of that I would like to see continue, especially, as Pat mentioned, having new vets entering the industry is, the profession of being a vet, I think, is so stressful. And I really do admire and respect the veterinarians that do it, because it's not an easy task. It's very mentally and physically taxing. And they still manage to bring a real level of like compassion and care to us as producers. And I think that's so amazing. And what I really love about my vet and our protocol is that we have such a good relationship that I can come to him with any questions and we can just have an awesome open discussion of why something might work or why it might not work, and keep in contact and keep in touch. And I think as a producer, what I'd really love to see is more vets continuing that relationship-based, really compassionate attitude towards us as producers, understanding everything that goes into producing beef cattle or any livestock really. Because I think, when your vet has an understanding of what you do on the ground, it also helps make that discussion so much more open for us as producers, and vice versa as a producer, understanding what your vet has to go through on a day-to-day basis. So I think those open conversations are really something that should continue and keep going, and maintaining that understanding of the industry and what all comes with that.
Great point, Mackenzie. I think that really points to what we had been chatting about earlier, which is that ongoing trust and relationship, and that level of compassion for, the work that each other does is super important to that. The next question I have is for Ricki, and we've chatted a little bit about what the herd health protocol looks like and what that document can really take shape as. But what are the elements of a herd health protocol that are important to include for the purpose of the VBP Plus program, but also just as a tool for the beef cattle operation?
Well, a few important aspects of the protocol that are important that, one, it includes the operation information on that. Two, it includes the vet clinic or the veterinarian that's involved with the protocol as well. And that gets down to knowing who that relationship is and having that contact information readily available. The next part of the protocol that's also important is, what class of cattle are you working with? Is this a cow-calf operation? Is this a feedlot operation? Is it a cow-calf operation that's backgrounding their own calves or finishing their own calves? There isn't really a cookie cutter template that works for everybody, but by laying out some key points of it, you can narrow it down to what's important for your specific operation. So if you have, the different classes of cattle that you're working with on your operation, then you can break it down as to what vaccinations are important on an annual basis, what products to use, what is the administration time that these should be done. So using a cow-calf operation, for example, whether it's at birth, whether it's at, branding or spring processing, or whether it's at weaning, what products do you need? How much do you need? Because it also helps with the protocol to ensure that you're not sitting on a bunch of excess product that's just going to expire and not be any good. So you're kind of getting the right amount of products for the amount of cattle that you are dealing with. So there's the vaccination aspect of it. And then there's also the treatment side of it. What are some typical things that come up on an annual basis? Is it a mastitis? Is it a scours? Is it a respiratory? What are the products that you need to have on hand to deal with any of those illnesses that come up over the course of, whether it's seasonal or just on an annual basis on your operation? And then also just kind of a schedule on when these things should happen. Is it a castration, preg checking, weaning, parasite control, dehorning? So kind of breaking it down to the different classes of cattle, the different annual events that need to happen on your operation, and then what products, how much product that you need to ensure that you have everything that you need, the right tools for the job when you're executing the task.
Thanks, Ricki. I love that point about it almost being kind of a shopping list or an inventory tool. I think that points to another benefit of it on the economic side of things, in that we're not, having a bunch of excess product that's getting wasted, because we all know that these products are not cheap. So it's important to manage that inventory as well. Moving on to a question for Mackenzie. So we've talked a lot about how the process of developing a herd health protocol is important in relationship building and kind of helping you be prepared for some scenarios. But any other comments to add on how that process helps you as a producer, and then how the tool is useful to you once it's developed?
For sure, yeah. So, like I had mentioned, having that tool kind of printed out and in our, you would call it like our medicine cabinet, I guess, is really helpful just to keep everyone on the same page. I mean, on our operation, I'm fortunate enough to be able to farm with both my mom and dad and my brother. So at any given time, there could be, 4 or 5 of us looking at the protocol, trying to decide what to do with a sick animal. So having that written down and laid out, approved by our vet, what the first and second options are for each situation is super helpful. Um, and it also is helpful when we're laying out our kind of vaccine calendar. So when we're thinking about when we're wanting to vaccinate pre-breeding and what that timeline should look like based on our recommendations from our vet. I mean, really, I use that template as a holy grail. So, it tells us what time of year we would do this and what to start with and what to finish with if that isn't effective. And, really, it's almost like those of us who have ever had to start a new job, it's like a new work manual on what to do as you're going through. So I find that really helpful, and that's definitely, I would say, how we utilize it the most. And then it's also really great to be able to have the vet clinic go through that holy grail and have it in our folder so that when we're calling, trying to order vaccines or trying to order antibiotics for a certain situation, we can phone the clinic and everyone is on the same page of what our kind of approved protocol is. So I find it, I guess, in a nutshell, we would use it as a holy grail for all things treatment and herd health. And it's a really helpful tool as a producer for that.
Great. And that last point about calling the vet and having the clinic kind of be on the same page is a great stepping stone into the next question, which is on the flip side for you, Pat, how does the process of developing a herd health protocol with a client help you as a vet? So we've talked a little bit about relationship building, of course, and getting to know new producers, but on the practical side of things as a tool, how does having that tool on the farm help you as a vet?
Well, part of our responsibility as a veterinarian is understanding, the animals on the operation and the management processes that go along with those animals. So initially in the initial conversation, it's getting a good understanding of what's happened in the past and what are our issues and and managing those to the point where things are going pretty smoothly. Obviously, from a veterinary perspective, it helps us tremendously when, if something should go sideways health wise on the operation, we have a good understanding, and the staff at the veterinary clinics have a good understanding of of what the operation is like and what the protocols are, so we can better address sort of an emergent situation in a timely fashion. Um, it's I won't say it's unfortunate, but it's part of my job that I routinely receive texts, emails about different sort of situations from clients I've had both in the past, meaning in different locations than I'm actually now. And it to me that's part of the job. We're the mechanic of animals, and so doesn't matter where we are, who we with. Technology allows us to be accessed, and certainly providing feedback in a timely fashion to producers based on that relationship we have with that herd health protocol just makes life go a whole bunch easier.
Thanks, Pat. The next question I had is, once you've created a herd health protocol, how do you use it?
Yeah, I think the key is really it's only as good as what you put into it, right? So, we try to make sure it's really up to date. It's not just a sticky note scribbled out with our vet. We print it out, we make sure it's in our vet's files, we keep a copy of it with our medicine cabinet so it's easily accessible to everyone. And I think that's, for me, it's been a successful way to use it. I think there's probably, if you were using a program that was more digitized, in your day-to-day operations versus entering things after the fact, you could have it entered into something like that. But a good old printed piece of paper works good. But I think really it's like anything, you get what you put into it. So the more detail you can put into your protocol for people to follow, the more you can reference it throughout the year.
A couple things just to add is, the protocol itself doesn't have to be anything that's over the top fancy. You just need the important information. But it is valuable to have it, in a digital format so that it's easy to make updates on an annual basis, so you're not having to rewrite it each time. And it is good to have, the vet to have a copy of it on their files as well as you, so that it's easily available and repeatable on an annual basis. And with the technologies that we have being developed from a data management platform side of things, is there's getting to be more programs out there that you're able to put those herd protocols right into your data management program and have those protocols automatically come up with, here's the temperature of the animal, here's the weight of the animal, and it helps you figure out what you need to treat that animal for. And I think that that's a valuable tool as well, as keeping everybody on the same page. And whether you're the pen checker or the pasture rider or the guy that's paying the bills, everybody's on the same page of what products to use at the right time to use, and not over administer or just do a Hail Mary and treat with whatever you got and hope something sticks to the wall. It just kind of helps keep things a little bit more in line and using the right stuff at the right time.
Well, I think the herd health protocol is an opportunity for veterinarians to educate producers. We know that the producers live 24/7 with their animals and know their animals best, but it gives us an opportunity over time with that relationship and on a herd health program to really help, sort of fine tune, what's going on in the herd. And certainly it's early detection is key to sort of success on a treatment basis. And so I think veterinarians are very helpful in getting producers to understand what a respiratory disorder is, what a lameness may involve, whether it's an infectious or a non-infectious process. And so producers are then better able through a protocol to make better decisions on how to manage their animals. And so I think it's good for both sides. I mean, we continue to learn from the producer and the producer continues to learn from us. And so it's a win-win.
The next question I have is for Mackenzie and Ricki. Both of you are certified producers. And then, of course, Ricki has another role within the VBP Plus program. And that is, how can producers use a herd health protocol as a tool to help them in maintaining their VBP Plus certification? So, Ricki, maybe we'll start with you from the program management side of things.
The herd health protocol or herd health plan helps really validate that vet client patient relationship. That's kind of the number one thing. The second part of it is when it gets down to the treatment records, you have a little bit more trust that the information that's being recorded is based on a plan that has been made with the veterinarian. If there is the off-label use, there again, that it's done in consultation with their veterinarian. It helps just kind of fill in the gaps and reduce the number of questions that you have, that you're just not picking, random things and treating. So it really helps from a VBP perspective, show that relationship, know that the information that's being recorded is based on the conversation and the plan that has been set out by the veterinarian. And then it also just helps build that trust within an industry as well, that producers are being responsible with the use of their antibiotics and making sure that their animals are staying as healthy as they can through vaccination programs and treatments throughout the year.
I mean, honestly, for me, Emma, it's really convenient to have it, like Ricki had said, in a digital format that I can take when I go to do our audits. It's easily accessible. I can pull whatever information I need from it. We have the records to back that up. So it makes your audit a lot easier. It's kind of preparing for it before you start, for sure.
Great, thank you. Next question is for all three of you, and that is related to some advice for producers that maybe don't have a herd health protocol yet, and are thinking it's a worthwhile thing to go through. If a producer is feeling intimidated by herd health and developing a protocol, where is a good place for them to start?
So I know Verified Beef has some excellent templates on their website, and that's actually what we utilize. I went through it with our vet beforehand, so that template works for him as well. I can't speak for other people's vets, but I think they're pretty good evergreen templates to utilize. So that's great for resources. And then I think for producers that are maybe feeling a little intimidated by it, I really think that honestly, just having that opportunity to meet with your vet and take that time is so, so valuable. And I think that is something to really look forward to, not be intimidated by. It's worth the time. It's an opportunity to ask any questions you might have, and go through the templates. So definitely the Verified Beef website for actual materials, and then just having that FaceTime with your vet is so valuable.
Well, I think it is an interesting question, but I think if the producer has decided, hey, I need to investigate a herd health program, then I think they've come to the conclusions that there's some improvements that can be made. And so, having said that, I think this is, when they're entering into it, I get if they haven't developed that relationship previously, it can appear to be intimidating. But there's no dumb questions, right? I mean, nobody was born with the manual in their head. And so, from a veteran perspective, we get questions about all kinds of things. Some of them are pretty bizarre. But at the end of the day, we're there to help them out. And so, it is because of the level that we're dealing with, when we're talking about certain classes of drugs or the use of drugs, or even some of the medical conditions and terminology, it can be intimidating. But the bottom line, we're there to help. And so don't be afraid and have to make the phone call. That's the thing is I think the toughest part. One thing that I will caution is don't be discouraged. And when I say that, again, the veterinary profession is struggling for professionals, and so sometimes you make that call, and it's not returned sort of within 15 minutes, and so but be patient. Certainly, if you have a question, that can ease yourself into the conversation. So, in contact with a veterinary clinic, just say, hey, I'm new, or I'm new to the clinic. I'd like to develop a relationship. Sort of briefly provide the staff with some of your background, size of the operation, and the fact that you want to have a conversation with a veterinarian. And I think once you get past I have to make this phone call, I think the rest comes very easy.
I think the very first place to start, if they have some exposure to VBP, is to go to the website and go to our module 6, which is vulnerable, distressed, and high-risk cattle. And in there, it talks about building a herd health plan for either a cow-calf operation or a feedlot operation. So it kind of gives you that intro of what it's about, what information you need to look at. And on the back of that module, as well as in our sample records, there's a template of a herd health protocol plan. And those are great places to start, because you can kind of get the information out of your head, what you're doing on your operation already. What are some themes based on your records that you have up to this date? Here's what we've treated at calving. Here's what we've treated at weaning. And then you can help when you go to the veterinarian after you've made that call. Here's your information that you have, and you guys can build a plan together. It helps you have all the materials that you need, and then it helps kind of take that pressure off and time off from everybody, and you can kind of focus on more of the details of it. And 100%, we know that our veterinarians and our vet staff are super busy. So patience is a big thing, but don't be afraid to follow up as well. Because we know on everybody in the industry, things sometimes slide off the side of the desk or the radar screen. So don't be afraid to follow up and with having that information ready for you, it helps kind of take that time and narrow it down on that initial build. And then after that, your annual conversation with them is much easier because you already have it built. And it is important to go back and visit that annually because things do change, environmental conditions change, and then you can make the adjustments that you need on an annual basis versus waiting until something happens and you have to make more costly decisions.
Thanks, Ricki. Staying on the theme of VBP Plus resources, VBP has recently created a pocket record book. And I'm curious if you can chat a little bit about the book and what it looks like. And then in terms of the topic of this episode specifically, how it can help with herd health and how producers can get their hands on it.
Absolutely. So the pocketbook that we released here last year, we did it in collaboration with CCIA, the Canadian Cattle Identification Agency, as well as BCRC, which is the Beef Research Council. And it's kind of all you need in one spot. It's got your birth records, and it's like 250 records you're able to record in there. It also has some QR codes as well as some little tips and tricks on whether it's injections, administration routes, body condition. And then it also has some pages on the later half of the book so that you can include your treatment records right in there, your group vaccination or treatment records right in there. If you're using medicated feed or water, those records are in there as well. And then it also gets into a little bit more some other information on pastures and pasture movements. And then there's some great resources that BCRC has provided in there with some carrying capacities, water systems, their Forage U-Pick app that they have as well. And then knowing that on some forages, there's some chemical or application that needs to be done on it. So it has a template or a record in there as well to document that, to ensure that, the forage is safe to graze before cattle go in there. And then there's also, to record your, if you lost tags, so that you can document changes of tags from your CCIA perspective. And then, as much as we all know, if you're going to have livestock, you're going to have dead stock. So there's also a section in there where you can record deaths or euthanization of cattle that you have, so that it kind of becomes your inventory management as well, which then ties into another record of incoming and purchase cattle. So, if you're buying bulls in or buying replacement heifers, it kind of gives you another spot to record that in there, as well as your shipping record, which is kind of the last one in there. So it's easy to flip to is, when cattle are leaving your operation, whether you're shipping them through the auction market or direct to the next owner. It has that template in there where you can document what cattle go and ensure that you've done the checks, that everything's clear of withdrawal and safe to ship prior to shipping and when it goes to the next owner. So it's a lot of information in a small little book, and it's the nice little pocket size. It's not super huge, but majority of these templates that are in here are also available on the VBP website. So to get your hands on the pocketbook yourself, reach out to one of your provincial coordinators. There's one in every province. They'll be able to get some to you, as well as you can contact the national office, or soon we'll be having a web store on our website where you can order them directly and have them shipped direct from the national office, anywhere from 1 to as many calving books or pocket books that you need to manage your operation.
Thanks, Ricki. The last question I want to close off with is a question for everybody, and that is just some last advice for producers that are getting started with this process. And really, what have you learned along the way in managing herd health that could help those other producers?
Well, I guess my biggest learning to help other producers is just the knowledge of new drugs to the market and what that looks like, I think is really helpful. over the years. I think including, since COVID, obviously we are all very well aware of the supply chain restrictions that we run into as producers. So having that conversation with your vet, I think is really helpful too, just understanding that, in the case of a back order, what are my options? In the case of a back order, should I be ordering really early on some things? I think that's a challenge that we didn't run into as often in the past. And I've definitely learned over the last 2 years that having that conversation as a part of your herd health protocol is great, because there's just no way to guarantee that you're always going to have the medication that you're looking for in this day and age, unfortunately. So it's really good to have a backup plan. And I guess, yeah, my other biggest learning, I feel like I'm a broken record, but it's just being able to sit down and talk with your vet is just so much more helpful and valuable than I think anybody could have realized when this first came to light as a guideline for producers. I know I certainly didn't realize how valuable it would be to have that time with our veterinarians. So I think that would probably be the most important learning, followed up by keeping in tune with like new industry trends, back orders, new drugs, that kind of thing.
Well, yes, I've certainly learned a lot along the way, and probably the single biggest learning sort of reward was how successful those programs can be. And I'll take a brief moment and tell a story, and that's what I usually do anyway. But one of the young veterinarians that I have been mentoring the last couple of years, great guy, young fella, dad has a cow-calf operation, and he came to me and said, look, dad's sort of struggling. And because he was a young veterinarian, he didn't have a great deal of experience in sort of, well, let's have a look at this and put this together. And we just made a couple of very, very, very simple tweaks to the management of those cattle. Something as simple as let's pull a bull on a specified date, and let's get rid of sort of some baggage as far as worn out cows go. And he's into his second calving cycle this year, and his dad can't believe how well it's going. And so it doesn't take much, but sometimes as producers, and this is human nature in general, we live in a bubble and we have a hard time coming up for air. And so, we really don't see what's going on around us. We're just fixated on our own situation and maybe perhaps what goes on at the coffee shop, which isn't entirely great information or a great source of information. But I think if making that conversation, having that conversation with a veterinarian or making that call, can really open your eyes to, oh, okay, this is how it should look. And so it's tremendously rewarding from the veterinary side of it to hear clients come back and go, wow, what we did made a dramatic difference on the positive side to our operation. And so that's something that I've become very comfortable with. I like that. It makes the job fun.
I kind of have two different, wearing two different hats on this from a producer perspective as well as the VVP perspective. But a couple things that come to mind is with having the herd health protocol and having the conversation with your vets, it becomes you more aware of what options are available, because producers are busy just like veterinarians, and we might not have time to run to town and have the previously have the conversation, and you kind of got your blinders on, and this is what I've been doing, this is how I've always done it, and there might be newer, easier ways to do. And I think some of those little tweaks and changes can make some big differences in your operation. Similar to the story that Pat used, a little change can make a big difference. The other thing that I think is important as well, and Pat, you can correct me if I'm wrong, but I think that by going through the process of the herd health protocol, and having that conversation with the producer and the veterinarian, it helps take some of the pressure off the veterinarian as well. You're not dealing with you're not having to deal with as many outbreak situations because you've put the preventative measures in place and you're not having to deal with those. You can have the conversation on a less stressful time to make decisions that will reduce the effect of major situations down the end. And a couple other things that from a producer perspective as well is from the herd protocol side of it, it also encourages you to do the record keeping on the other side of it too, by documenting more consistently on what your treatments are and why you're treating them or why animals have died. It helps kind of develop those trends that you can make some decisions based on and make improvements to reduce those negative outcomes. So I think that that's been really good as well. And then even from an inventory management, Mackenzie touched on the supply chain side of it, but it's also from a producer perspective. Years ago, I remember when mom and dad, we run a large multi-breed bull test for quite a number of years, and the drug cabinet was fairly large, and stuff didn't necessarily get used and sat on the shelf for a long time. And since we've come on board with VBP and been more on top of the herd protocol, we've actually reduced the number of products that we have to have on farm because we don't need the volume anymore, and we can keep those products more fresh. We maybe don't need to buy the biggest bottle. Buy what you need to get through the year or till the life of that product, so that you can use it so it's got the most effectiveness as well. Because as you get to the end of the shelf life on those products, they might not be as effective as they are as a newer batch. So there's kind of a few different things that I've learned along the way, and don't be afraid to try something new. Have the conversation. It's worth it in the long run.
Thanks, Ricki. I think that's a great way to end off, that, these things do pay off in the long run. That's investment of efforts. So that's a great way to close things off. Thank you, all three of you, for joining the podcast today and for sharing your thoughts from all of your different perspectives, and for all of your work that you do every day for the Canadian beef industry. We really appreciate it. That's it for the 4th episode of Season 3 of the Simply Verified Beef podcast. Stay tuned next month for the next episode in this season.